Dr. J's Prescription for Health. I am your host, Dr. Malea Jensen. This is my co-host, Tucker. He is co-hosting from heaven. All right, so we will get started here. We'll wait for everybody to join in. Galley Windward, Gallic Windward. Hello, Janet. And let's see, we are live right now on Instagram and YouTube this morning. So Instagram and YouTube, so please share. If the information I provide for you is helping you and you think it can help somebody else, hit the like button, hit the share button, do all the clickety-clack stuff that we need to be done, okay? So, all right. Red Hat has joined us, and John, thank you for joining. I thought today we would start out, again, this is your opportunity to ask questions, medical questions. Again, this is not medical advice. This is for information purposes only. I am a family practice physician. I am practicing in Des Moines, Iowa. I've been practicing for 27 years, little over. So I am well-versed, but I do not know all the answers. And I will tell you if I don't know the answers. I'll tell you to look it up, or let's work on this together. Let's look it up together. But we need to be on board with the fact that, again, this is not medical advice, all right? So information purposes only, maybe a little bit of entertainment spruced in there. So if you guys have questions, please ask. Just put, for the YouTubers, please put a QQQ in front of your question. And same goes for Instagram, but you guys, I am more comfortable with your questions and your, let me see who we got here. Okay. All right. So first off, I want to discuss plants. I know those of you who are very familiar with me know that I avoid plants. There are reasons for that. They're my reasons. I have taken the information that I have gleaned and I have chosen not to eat plants, not to consume plants. Of course, I do consume them as long as they are filtered through a cow. Now, this morning, I'm going to give you reasons why I choose not to eat plants. Okay? And one of those things is a substance called oxalates. You see, plants have chemicals, toxins in them because they do not want to be eaten. They don't want to be killed. And so since they don't have fangs and paws with claws and they can't run from people, they make chemicals to put out into their leaves and their stems so they will not be eaten or consumed by predators like us. We are a predator of plants. You might not think that because you're not out in the wild, which maybe you should be, because if you eat a wild plant, you will know exactly what I mean about poisons and toxins. But there are things that are in a plant that they produce that they do not want to be eaten, and one of those is oxalates. Another is phytates. Another is tannins. Now, oxalates are normal in our body, but not at the levels that we are consuming. In fact, our body makes oxalates. All right. Oxalates made in our body is about 12 milligrams. We make about 12 milligrams of oxalates. Our body can handle that 12 milligrams. In fact, it probably could handle about 26 milligrams ultimately. But we consume in greater amounts, and many people, many experts will tell you that you could handle 200 milligrams max. If you have kidney dysfunction, it might be more like 100 milligrams. We don't want to be consuming all of these oxalates, and I'll tell you why. But let me give you an example of something like spinach. 100 grams of spinach, that's about 3.5 ounces, has 1,000 milligrams of oxalates. That's in raw. Raw oxalates, raw spinach has 1,000 milligrams. We're only maxed out 200 if we're healthy. So you're eating or consuming in one setting 5 times normal. Okay? Now, when we make our own oxalates, we do that from vitamin C. Let me see what this question is. Janet is asking, are your thoughts on olive oil the same as on plants? I agree 100% with you on the plants, but would like to know if oil of a plant could have any exception. Thank you. Well, the short answer is no, I do not consume olive oil. That is up to you. It is a plant. I don't consume it. I would ask, one, why do you want to consume the olive oil? Like what does it have that you need, that you want, that you choose to use olive oil? The other thing, going down rabbit holes, is olive oil is not olive oil. It's been cut. No matter where you get it. If you think I bought it from some foreign country and it came in a brown or green bottle and they said it's 100% pure, I wouldn't trust it. But you have to know why you want to use olive oil in your diet. I choose not to. Just like I choose no plants at all. -1. We'll get to that too. So how do oxalates get made in our body? The answer is vitamin C. Vitamin C degrades into oxalates. Okay? So if you are a person who's taking a ton of vitamin C as a supplement, you are super absorbing any other oxalates that you are consuming. That's how poisonous they can be. And rapidly, the categories of oxalates that I like to talk about are, say, nuts and seeds. We'll put a couple in there. It's like chia seeds, or what about almonds or peanuts? So nuts and seeds are high in oxalates. Green leafy vegetables, I mentioned spinach. Just a small amount of spinach, like 3.5 milligrams, 3.5 ounces, which is 100, about 100 grams, is 3.5 ounces. That alone has 1,000 milligrams in it. What about beet greens or chard? Those are really high in oxalates as well. What about almond milk? We're talking about nuts and seeds. Almond milk. Eating almonds themselves. Almonds, I mean, if you're a guy listening right now, I would avoid almonds at all costs. They lower your testosterone levels. We're not squirrels, you guys. But again, what about dark chocolate? What about this one? Somebody says, oh, I don't eat vegetables, but they eat a lot of potato chips and French fries. Guess what? Potatoes. They are so high in oxalates. The starches, tubers, people say, I'm going to take turmeric for my inflammation. Full of oxalates. Then you mix it with pepper, which makes it super absorbable. So just by adding in spices like pepper to the turmeric, because you want better absorption to help you with your inflammation, well, you're getting better better absorption, all right. You're getting better absorption of the oxalates too. What about beans and lentils? People say, oh, the beans are great. Well, 2 reasons that I would not choose beans. One, in order to get rid of all of the lectins and the oxalates, phytates, tannins, you have to actually soak your beans for 3 days, 3 to 4 days. How many of you are soaking your beans for 3 or 4 days? How many are pressure cooking them after that? We eat these things and we don't realize you're eating some baked beans. The summer is great for this. The summer season, you're going to have some baked beans. You're going to have some potato salad. Then you're going to have some spinach on the side with some collard greens. You, in one meal, one little picnic, have eaten 10 times the amount of oxalates that you could possibly consume, possibly absorb and tolerate. These oxalates are like crystals. They're crystals and they can cut like a knife. They're shaped like a spear, or they're called raphi, and they're pointed like a sickle. Okay, and we're consuming these things. The minute you put it in your mouth, it's cutting through about 2 layers of skin cells in your mouth. That gets into the bloodstream even faster. That coating, when you eat a spinach salad, I did it because I was told that this was okay to eat when I was dieting for shows. And even thereafter, oh, it's better than iceberg lettuce. It's got more nutrients. And then you get this coating on your teeth. That's the oxalates coated to your teeth. These are some of the reasons, but the thing is, what really I want to caution people is, since COVID, the last 5 years, people have been really taking in a lot of vitamin C. I understand, you want your immune system to be healthy, but you're taking in so much vitamin C and it's basically just degrading into oxalic acid. And so when you're taking in all of this vitamin C and the oxalates, because it's in the things that you're eating, it's in grains. You guys are eating wheat and bread, and you even had a hot dog bun or a hamburger bun while you were on your picnic. So you had the bun with the flour, and then you had some potato, which is the starches, and then you had some colored greens, and then you had some baked beans. Could you imagine how much oxalate toxicity you got just in one meal? And you say, well, I've never had any problems. Well, until you get problems, right? And so the reason that you might not have had problems, but related to the oxalate primary, is because all of your calcium that's in your body started binding to the oxalates to try to tame it down. So you're going to get oxalates taken out of your bones and teeth. And over time, what if you did this every summer day, and then in the wintertime, you switched over to drinking a bunch of teas, like black tea or even green tea, and then you put some almond milk in it? You can see where this is a seasonal thing, but I just brought up the summer because it is times for picnic, and you're going, oh my gosh, this is crazy. Rachel says, greetings from South Florida. Greetings. What are your suggestions to eliminate chronic pain and inflammation? I believe that I was guided here for a reason. I've never seen you before. Happy I found you. Well, thanks for joining in, Rachel. And I'm happy that you're here as well. For chronic pain and inflammation, there are many things, but I always start with diet. I do an elimination diet. I have people do meat, salt, and water. Eliminate everything. After 30, 60, 90 days of meat, salt, and water, add back in one food at a time. See which one is causing your inflammation. There's also heavy metals that are toxicity. There's plastics, there's these oxalates. There's a lot of things that could be causing your chronic pain and inflammation. Taking medications is not it. I think we need to eliminate whatever is causing it and then move forward. Some of you can't go back to eating all of your... Fire Tiger says, what's left to eat? Just meat? That is an option. Yes, Fire Tiger. You have to do what's best for you. Good morning, Lucy. Linda says, when you state plants, do you only mean the leaf, or it's the broccoli leaf and the broccoli? Linda, it is the whole plant. Broccoli is fake. It is made from something else. It is not found in nature. And you say, but I tolerate it fine. Well, in small doses, you tolerate it fine. They made it so you could tolerate it fine, and it just builds up in your body over years. One other thing I wanted to mention to you, the reason plants have oxalates is, one, it is a defense mechanism. I want to be perfectly clear that it is a toxin. But one of the reasons that the plant actually needs the oxalate is to manage their calcium. You see, especially today, the terrain, the soil is that most plants grow in is very, very high in not only heavy metals, but also calcium. And so when they're taking in all this calcium, they need some, they just don't need as much as they're probably getting. The plant, I'm talking about the plant. Now, when the plant has a need for some oxalates, but not too many, it has a need for calcium, not too many, it needs that calcium to be bound up. And that's why the oxalates are one of the reasons oxalates are made by the plant. We can't tolerate them either. So we're going to get it bound up. All right. That's why we get kidney stones. Kidney stones, 80% of kidney stones are from calcium oxalate. Calcium oxalate stones, our kidneys are wanting to get rid of all of these oxalates. Now, some of you might be listening right now and say, some of the things that people will say is, well, if I sprout them or ferment them, that they are going to be better for me. I cannot disagree. So if you're a person who's going to eat some wheat or some buckwheat, which are very, very high in oxalates and phytates for that matter, so you're getting a double dose, and you'll say, oh, I'm going to sprout them, or I'm going to ferment them, or just eat the grouts. They're still containing of oxalates and phytates. You're still getting them. So that's what bothers me about, people say, well, I'm just going to eat these plants, I'm going to do these things, and I'm going to hope for the best. I'm going to soak my beans for 3 to 4 days, and then I'm going to pressure cook them so I don't get phytates and oxalates and tannins. Great. If you want them that bad, do it. But I'm going to tell you right now, when you get done soaking them for 3 to 4 days and you pressure cook them, the nutrients that you think were in there are gone. So my question is, why consume them in the first place? Okay? So you're eating these oxalates. You consume them. They're like little sickles. They cut through your epithelial skin layer. They go systemic. Then what happens? Well, they go to the liver. And when they go to the liver really doesn't detoxify them. Then they get into the heart, the lungs, the bloodstream, everywhere. Crystals in your blood. What about heart disease? What about lung disease? These are just some of the things. And, again, you guys might be A-okay with eating these plants. It's fine. But I just think that you need to have enough information that you know the risks of taking in so much anti-nutrients. They're toxins. And like I said, I used to eat vegetables. I used to eat spinach salads. I used to eat beans. I used to do all these things. And then one day I was on YouTube and I watched a video that was a lecture series by Dr. Anthony Chaffee. And the name of the lecture series was Plants Are Trying to Kill You. And honestly, you guys, the next day I gave it up. And it wasn't even really hard. I mean, I ate them because I thought they were good for me. I thought they were good for me. I told people to eat them because I thought they were good for me. So it's not like I'm flip-flopping, but we learn stuff and I say, oh my gosh, I'm not doing that. I don't even want to risk it. I get none of that in animal-based diet because it's being filtered. All of those plants are being filtered by the cow or the deer or the bison, buffalo, sheep, lamb, whatever it is. Those are the ruminant meats I eat. Rachel says, do you have a website? I do not. I am on Facebook, Instagram, and YouTube. I'm also on Rumble. Facebook, I am under Center Stage Primary Care. So you can follow me on those platforms. I'm at IronLadyDoc and everywhere else. I've had severe foot and leg cramps every night for 10 years. You take lots of magnesium. Well, then if you're taking lots of magnesium and you're still having leg cramps for 10 years, then I would suggest to you it is not from the magnesium. You might want to check a B12. You might want to check a folate. You might want to get iron studies. You likely have iron overload. I would get, an iron, a TIBC. Would get a transferrin. I'd get a ferritin. I'd get a CBC. And I would check with some people who study iron to great lengths, and that would be Mr. Glucoferrin. So go to @Glucoferrin, and you might be able to get helped on that sort of stuff. But 10 years is a long time just simply treating yourself with some magnesium or some potassium or things like that. Jackie says, could you comment on foods eaten in the Bible? Example, fish, figs. bread, honey, olives. Thank you. Well, as you know, the Bible was written many, 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 many years ago. Many years ago. And I don't believe that the foods that are mentioned in the Bible is the exact same foods that we have today. So if you want to be bamboo, I get this every day. Somebody wants to slam Jesus back in my face. And one, I don't really appreciate that, but maybe you're just innocently asking these things, but we need to use our brain. And those foods back in the day, if that's what they were when they said it's a fig, if it's really the fig of today, but yeah, figs are bad. Are dates better than figs? Absolutely. But, you know, all of these things back in the day, they didn't have heavy metal toxicity back then. Their olives weren't poisoned and fake. Again, I am a Bible-believing Christian. But just because something is written in the Bible and we're going to translate that to today, I can't do it. Okay? So if people want to eat the nuts and the seeds and the chias and the chard and the spinach and the buckwheat and the wheat and the potatoes and the dark chocolate, that's another one high in oxalates, and the quinoa and the beans and the black teas, I'm not telling you not to do those things. But if you have a question and you're saying, well, comment on the foods eaten in the Bible compared to today, it's not the same. We have man-made stuff. Man has corrupted things in the Bible. All the foods of the Bible has been corrupted by man. And then they tell us it's good. And then they'll tickle your ear and say, well, the Bible people ate it because you're a Bible-believing Christian. So you're going to emotionally feel this tug. So, well, they're telling me that it's okay. I'm telling you, go ahead and eat them. But if you're wondering why you're sick all the time, you got rashes, you got itches, you got hives, you got mast cells. Those are oxalates trying to come out of you. Your urine is cloudy. Your muscles and bones hurt. You get skin rashes. You got gunky stuff coming out of your eyes. You got chronic sinusitis, chronic allergies. You get flu-like symptoms easy. It's wrecking our white blood cells and red blood cells. It's wrecking your immune system. So that's the inflammatory part of what's going on. And that's why I'm trying to get you to maybe consume less of these things. If you're thinking, after hearing me today, say, oh my gosh, I'm quitting all of the oxalate toxic foods, and you're going to quit tomorrow, I probably don't suggest that. You need to go slow. You know, if you have heard of oxalate dumping, it is real. You don't want to go from eating potato salad, beans, a bun, and some breakfast buckwheat or some other wheat product or anything like that, and you go from that and some potato chips and a sandwich for lunch or supper, you're looking at a lot of oxalates, and your body has gotten used to them. You have become resistant to the oxalates. Your body is storing them. And the symptoms you think is just normal aging. Just like iron. I have talked at length about iron overload. It is one of my newest topics, so to speak. Oxalates I've talked about in the past, but iron is intriguing. And anyone who's trying to watch iron overload, non-heme iron overload, that's also ruining our liver and other organs, our skin, our eyes, our heart, everything. You're going to consume more plants that have non-heme iron in it that we can't absorb. So it's just getting stuck. I just say, stop eating plants. Make it minimal if that, but that is up to you. What I choose to do, but I'm just giving you the information. They're full of oxalates, phytates, and tannins. If you boil them, broil them, pressure cook them, soak them for days on end, ferment them, are you going to get less? Yes. You're also going to consume more. Oh, it's healthy for me. Just consume more. Well, then that's got more oxalates. But yeah, you should go very, very, very slow when we're dealing with trying to lower the amount of oxalates in our body. You know, going cold turkey would not be in your best interest. I actually did go cold turkey. I had no idea what oxalates even were 5 years ago. I mean, heard of it, never knew or even thought to look about how many of the foods I was eating that was full of them, how many of the foods that I was poisoning myself with non-heme iron. I knew about sugar. I would never touch a sugar, yet I would eat a bun on my hamburger. Sometimes, not always. Mostly not, but sometimes. So you're eating it. Is that okay? Once in a while? Sure. But maybe you add in, I had some beans, or you had broccoli or green beans, or had a spinach salad that were supposed to be so, so good for you. Yeah, those things. I've never eaten dark chocolate. I gave up potatoes. I took turmeric. I took all these. I took things with hydroxyproline in them, like collagen supplements. All of that adds up to all of. So you can see how, for me, my diet goes narrower and narrower and narrower, and finally you're just basically eating animals. I'm okay with it. I feel very well on that. Again, you know, it's a choice that you need to make for yourself. Linda says, can you share what you eat in a day? I eat about a pound of beef, a stick of butter, and I used to eat a dozen eggs, but I kind of backed off. I don't know why. I'm just not, I eat till I'm comfortably full and then I stop eating, but it used to be a dozen eggs and now it's maybe like 6. So I'm eating 6 eggs, a pound of ground beef, a stick of butter. I might divide that into 2 meals. But what is a good substitute, Gallic says, for broccoli? There is none. I would say meat, eggs. I know. There's Forever Cowgirl. She can maybe help defend me. Forever Cowgirl raises cattle up in the northwestern states. Is there a test for oxalates? Oh, good question. It is very hard to check for that, Rachel. Do you have a list of tests you mentioned for iron? Well, I can repeat them again if you got a pen. It's just simply getting an iron level, a serum iron level. I would get a transferrin level, a ferritin level, ferritin, F-E-R-R-I-T-I-N. And I would get a TIBC, T, all capitals, TIBC. I would get a CBC. You can tell a lot by looking at your MCV, which is on the CBC. So you don't need to know that, but a CBC. I would get a CMP. I would want to check for my liver function. So a CM, a complete metabolic profile. My Rumble channel is at IronLadyDoc, at IronLadyDoc. Same as YouTube, same as Instagram, same as Twitter or X. What else am I on? But for Facebook, it's Center Stage Primary Care. That is the name of my primary clinic. That is the name of my clinic, Center Stage Primary Care. I am an independent practitioner. I used to work in corporate medicine. I worked for all the big hospital systems. And yeah, our ideals, our ethics, they didn't align. None of them aligned. And so I decided to go out on my own. And it's been a glorious ride. Oh, Fit Carol asks, this is way off the subject of oxalates, but we're going to keep that topic going with the oxalates if you guys got questions, okay? You know, one of the things I failed to mention, hold please. If one of the, this is good. And I want you to be, one of the reasons I do not want you to go cold turkey and getting rid of all of your oxalates. I told you that calcium binds to oxalates, okay? If you were to go cold turkey, you're going to release a lot of the oxalates that are bound up. It could be in your joints, your skin, your hair, your liver, your organs, right? You're going to start releasing. You're going to dump it into the bloodstream. You know that calcium is one of the things that binds oxalate. If you are using all of your calcium that's in your blood right now for the dumping of the oxalates, you could get hypocalcium, low calcium in your blood. You could end up in the hospital. You could get an arrhythmia. It's called a bundle branch block. You could get heart failure. You could go into sudden cardiac death. Do not go cold turkey on your oxalates. One of the highest ranking oxalate containing plants is sorrel. There are people who have died instantly from eating sorrel soup. You go to a restaurant and it's got fancy cuisine, and one of the things on the list is sorrel soup. You consume it and you could go into a cardiac arrest. It is slammed full of oxalates, and it basically bound up all your calcium right quick, and you went into cardiac arrest. It's dangerous, you guys. You know, plant leaves, you know, you're asking about the broccoli and the leaves and all that. You see, these plants need the oxalates because it fights off pathogens like fungus, like predators, like beetles. And the beetles or the fungus can't live with these oxalates. It kills them too. So, you know, it's almost like using the oxalates and they're turning everything into something like it as an anti-infective, like hydrogen peroxide. And so it's kind of an interesting way that, you know, that oxalates defend the plant. They use it as a defense mechanism, and actually they've adapted to having them, phytates and oxalates and tannins. So it makes them go. Fit Carol asked something way off the beaten path, and it's on ketones. She says her ketones when she woke up this morning were 0.5 this morning. Is that fair? Yes, it is. To show I'm producing ketones, it is. You're using them, Carol. That is awesome. You don't want ketones in the morning. If you've been carnivore for months or years and you're still having ketones in your urine, or you're using your mojo in your blood and you're still having ketones, you're not using them. There's something going on. You want to if you've been in a ketosis diet, yeah, after a while, your ketones aren't going to show up. That's great because you're using them. You know you're in ketosis. You're fasting, you're eating animal-based, you're high fat, no carbs. Your ketones may not be very high because you're using them. You don't have enough fat on your body anymore. You've used that. Remember, fatty acids break down into ketones. So initially, when we start all these things, your ketones could be higher. And that's why we measure them, right? And, you know, I'm okay with measuring, but sometimes just know that if you're on an animal-based diet with high fat and no carbs, you're going to be in ketosis. There's no other way you'd be functioning. You can't live. So get this out of your head that we need to continue to keep testing. It's a waste of time and it's a waste of money, and it just gets you boggled. I get it. Some of you are just numbers people, but I think you're kind of hurting yourself by just relying on all of this and letting it consume you with these numbers. I get it, Carol. I mean, I know you're just on this journey. I get it. So I'm maybe not necessarily talking to you, but the people who are out there and they're just so emotionally tied to what their numbers are, it's only going to overwhelm you and cause stress and anxiety, and that's raising blood sugar and raising cortisol. We need cortisol. Don't hear me say we don't need cortisol, but it's over an abundance of being always stressed about something. So Rachel, hopefully I answered your question. Yep, you said thank you. Okay, so we're good. So Fit Carol, we hopefully answered your question. Linda says, if we don't have a gallbladder, is having that fat in the meat and butter, is it healthy? I'm guessing you're asking me if it's healthy. Is it okay? Of course it's okay, but you want to go slow. You don't have a gallbladder. What does the gallbladder do? We talked about this yesterday. The gallbladder stores bile and then secretes that bile whenever we consume fat. The bile is used to emulsify, break down the fat. It has a job to do. But many people have gone to their doctor and their doctor has surgerized them and taken out their gallbladder because they had some symptoms of not using their gallbladder. They had an attack. They had sludge. They had stones. So they just went to their doctor and they surgerized them. They make a lot of money surgerizing people. They didn't probably try anything else. But can you still eat fat? Absolutely. You just need to go slower. There is a possibility that the liver, which makes the bile from the fat and the cholesterol, it makes bile salts. And these bile salts can actually be stored in an outpouching of the duct. It can. We can develop a little mini pseudo gallbladder. But if you say, well, I don't know if I'm there yet, then eat smaller, frequent animal-based meat and fat. You might want to eat 3 or 4 meals instead of one big one, because you know that your gallbladder is gone and you can't emulsify all that fat all at once, and then you get diarrhea. You'll have to be in the bathroom. Okay? So it's important that you just go slow, and you might need to break down your meals into multiple meals, and then you can tolerate the fat much better. Forever Cowgirl says, yes, eat ruminant meat, eggs, butter, wild caught fish, and you'll be blessed. Exactly. And the key on that was, I had a fish question. I eat fish every once in a while. If I were to go to a restaurant and I get wild caught salmon, I love wild caught salmon. I'm not going to prepare it. I would rather have all of the nutrients in red ruminant meat versus salmon. It's just not as nutritionally dense. Is it good? Absolutely. Do I eat chicken? Sometimes. Is it nutritionally as dense? No. As red meat? No. Turkey? No. Fish? No. I'm not telling you not to eat those things. I'm just saying it's less good for me. It might be perfect for you. Okay? Forever Cowgirl says, I have a list of both fruit and veg oxalate, low, medium, high oxalate foods. Again, Forever Cowgirl, I appreciate people having a list. I just choose not to eat it. I actually have to go to the store for my mom today, and she called and said, I know you're at the gym, but can you remember to get me some blueberries? I'm going, oh my gosh, I hear I'm going to do this oxalate, this topic this morning on oxalates and plants, and she's asking for blueberries. And then in the same breath, she goes, and don't forget my rye bread and bagels. I go, oh my gosh. Oh my gosh. She's not listening to a word I say. And what am I going to do? I mean, the wrath of not picking up those things and showing up back home without them? You know what? At this point, she's heard my spiels 100 times. She wants her blueberries and her rye bread and her, potatoes. She eats French fries. She eats potato chips. Those are full. These starches, they're full of oxalates. Luckily, she doesn't drink black tea and eat almonds because it hurts her teeth. So good thing on that, right? Good thing on that. But yeah, it's a painful thing, watching family members poison themselves. I got her off the sugar stuff minus the soda, diet soda, still full of junk and chemicals. But again, you got to choose your battles. Forever Cowgirl says, well, have you heard of resistant starch? Well, not particularly. I don't know if I could. Lara says, oh yes, vinegar and salt potato chips. Most people just choose the Ruffles, Lara. Oh geez. You have to get my mom her bread, Cokes, cigarettes, nuggets, and blueberries. Lara, we're in the same boat. We are in the same boat. Lucy says, I tried my ribeye a little more on the rare side yesterday. Dr. J, not quite used to it yet. Lucy, I get it. I am there with you. It's just a gradual thing. And you know what? Back in the day, I remember eating hamburgers with my dad. And he would grill it. And we used a charcoal grill at the time. I don't even know that we had gas grills. And if we did, we couldn't afford it. I mean, basically, we cooked over a wood stove. So my hamburgers were charred. I remember when I bit in, they were so dry, and the char on the outside was an eighth of an inch thick. I loved it, smothered with ketchup and mustard and mayo. That's how I ate as a kid. We didn't have candy and sodas and all that. No, I thought I was doing okay. In fact, I would eat 2 or 3 of those burgers. We didn't even have anything with it. We couldn't afford it. Some days we have potato chips. Oh boy. Yeah, I was eating seed oils in the mayo, right? And then the ketchup was just full of sugar and plants. And then the beef was charred, which is glycated already, and then it got glycated in my body. So, what do? But over time, I'm less charred, less done, little pink. So I'm on the little to medium pink now, and then I can maybe do a little ground beef. I don't know if I could ever eat that raw because it has this soft, mushy texture. But a steak hasn't been ground yet. Yeah, that I can go for. Prime rib or, a less well done. Lara says we had fried bologna. I did too. We fried it we used butter. I don't know what you guys use. We didn't have oils back then either. In my day, okay? I don't know about you guys. Yeah, we had fried bologna. We had fried bologna and egg sandwiches. Yes, we had Tang. We did not drink Kool-Aid, but we had Tang because my dad thought it was good for us because it had vitamin C mixed in with the sugar. So that was a great technique because if you have sugar, full of sugar, you need that much vitamin C to knock the sugar off the receptors on the cells. I talked about that yesterday. On our cells, there is a receptor called GLUT4. GLUT4 takes in sugar, glucose, into the cell. Insulin helps it attach. Well, if you are eating a bunch of sugar, sugar will bind to that GLUT4 where vitamin C also attaches. So vitamin C uses the exact same receptor. So you're going to need more and more vitamin C to knock the sugar off to get into the cell where the vitamin C is needed as an antioxidant. Then we're basically using synthetic vitamin C at that. So, oh my gosh, it's a wonder I've made it this long, to be honest. But we just learn more and more. Back then, it was probably not as bad. It's much worse today. But, whoa, it's, peanut butter and jelly sandwiches on white bread. Exactly. We even got the Iron Kids Wonder Bread, thinking it was going to be even better for us. Oh my gosh, what a mistake. The Iron Kids, even more fortified with crap. Forever Cowgirl says, freeze bread before eating it. It's resistant starch, potatoes, and rice cooled or frozen before eating. You're right, Forever Cowgirl. My mom wants frozen French fries. And when I buy her bread, I will freeze one of them. So 1 out of 2 loaves will be frozen before she gets it. So I get it about the frozen. What I'm trying to say, Forever Cowgirl, is just don't eat it in the first place. There's no nutrient value to it. And carbs have no essential nutrients. None. We have essential fatty acids, and we have essential amino acids. There are no essential carbohydrates. You're eating them to satisfy your lust. There is no nutritional value. Yeah, but I like them. Then eat them. But there's no nutritional value. That because you like to eat them doesn't mean that they're nutritionally sound. They have no nutritional value. It's the opposite. It's quite the opposite. In fact, if you eat your bread with the nice burger or the juicy steak and have a sandwich, you just decrease the ability for you to absorb the amino acids and the fatty acids that are in the meat. So I don't want to do that. I pay good money for my ribeyes. I am not going to mix it with a plant with oxalates and phytates and tannins. I'm not going to mix it with a grain like bread or pasta or cereal or buckwheat or any of these other things. I'm surely not going to have a spinach salad on the side. I'm not going to eat dark chocolate for a dessert. I'm not going to eat that healthy quinoa. I'm surely not going to put baked beans with my hot dogs. And I gave up black tea or green tea or white tea or any of those teas. Do I drink coffee? I do drink coffee. I try to buy oxalate-free coffee just so I can feed my flesh, right? Rachel Rose says, I eat raw meat all the time. I feed my cats raw meat. I feed my dogs raw meat, you guys. Yeah, and they love butter. My Tallow, I named him perfectly. Tallow loves tallow, and Tallow loves butter. If I put butter in my mouth, he senses it immediately, and he is jumping all over me. He would try to lick it out of my mouth if he could. He's amazing. The other two, the two little weenie dogs, Tootsie and Timber, oh my goodness. No, they're not They're not butter freaks like tallow. I seriously did not know until, and now when I take a bite of butter, he's wanting a bite of butter. And he actually, you guys, I don't think I've told you this. They removed whoever dumped him in Oklahoma, in Norman. His name is Norman Tallow, by the way. His full name is Norman Tallow. So Norman Tallow was dumped by whoever had him. I rescued him. And they removed, I think they removed his voice box. So his talking sounds like a walrus. And when he goes crazy for butter, it's like a little walrus living in my home. He's so cute. Okay, so Rachel eats raw meat. She's feeding her cats raw, which cats are carnivores. Dogs are scavenger carnivores. They will eat meat. They choose meat. But if there is nothing else, like Norman Tallow was eating garbage. Ask me how I know. Look at his teeth. They are stained. For a 2-year-old, his teeth they're just not good. And they cleaned them already. And they said that some of that is not, it's not gonna, yeah. There's no change in that. So, but he's a love bug anyway, okay? Thanks for telling me about the vitamin C. I don't eat a lot of sugar, so we don't need extra vitamin C. Correct, we do not. In a ribeye steak, I think it's like 12 ounces of ribeye steak has 12 milligrams of vitamin C. In order to survive, you need 15 milligrams. If you eat sugar, it could go up to needing 1,000 milligrams, depending on how much sugar you're eating. But for a carnivore or somebody who's just eating an animal-based diet, 15 milligrams, it can be in one steak. And you probably eat more than one steak a day. And some ground beef, and then some eggs and some butter. And yes, we get enough vitamin C. But thank you, that was an awesome question. I appreciate that. How about carbs for fiber? Well, why do you need fiber? Do you need fiber to rough up your colon? Because that's what it's called. It's called roughage. The only time I would suggest that somebody eats fiber is somebody who eats carbs. Is my mom on fiber? Absolutely. I have to put her on fiber so she will have a bowel movement to exit the crapola that is in her gut. Now, if you're on a carnivore, animal-based diet, you absorb about 95% of the intake of animals in your small bowel. Nothing gets to the large bowel. So most carnivores will tell me that they only have a bowel movement 1 or 2 or 3 days, and they feel fine. But my mom, I sit next to her on the couch, and her stomach is rumbling, and she's passing gas. And, I remember when my first dogs, they ate kibble. And Nitro, he had the smelliest poopy butt. And again, this is 10 years ago, okay? I didn't know. I thought it was good for us. It is not. There's no nutritional value to fiber. We can't even break it down. It's called indigestible for a reason. It just binds crap. It makes crap. And it gets it out of our system. That's called waste. Why would we want to have waste? That means we couldn't use any nutrients out of it. Our body has no ability to break down plants because of the cellulose in plants. We, as a human, do not have cellulase enzyme. Not even the bacteria that live off the carbs we're eating have cellulase. They ferment it and the rest comes out. They ferment the sugar. That means taking the sugar out of the plant. They do not have cellulase enzyme to break down cellulose in a plant. And then the crap comes out. Crapola that you consumed. Crapola. You do not need fiber. This all came about. I remember when I was a resident? I was a medical student. I remember doing a rotation with this GI specialist. She told us, she was telling all of her patients as they were getting their colonoscopies, you need 35 grams of fiber a day. And then you wonder why they're gassy and bloated and abdominal cramping. I heard one patient say, get this, I'm not trying to be gross, but they said the greatest feeling in the world, even better than sex, is having a bowel movement. I'm saying, seriously? You need to get the crap out of you. That is the best feeling you've ever had. Don't put the crap in you. Okay. Can you explain why someone would suggest donating blood to lower ferritin levels? Lucy asked this question. 1, we need to first understand that there are 2 types of iron. Ferritin is a protein that binds iron. Okay? So Lucy is asking about ferritin. She is under the impression that ferritin levels need to be lowered. If ferritin levels are too high, they need to be lowered. I'm here to tell you that too low a ferritin is just as bad as too high a ferritin. Now, since we know that iron is either heme iron or it's non-heme iron, we get those from two different places. We get heme iron from the naturally red meat that is heme of animals. With the exception, eggs have non-heme iron in them, okay? We get non-heme iron from plants. So for all of you eating all of these plants, you're getting an excess of non-heme iron. Our body naturally cannot absorb non-heme iron, maybe about 3%. Whereas in heme iron, we can absorb about 30%. If you do not have iron in your body, you are not alive. Your brain's not functioning. You need iron in order to live. God made us perfect, and he made us perfectly in need of certain things, just not too much of it. We have been poisoned by big food, the food industry, and the medical industrial complex. Yes, we have. And that has translated into somebody called an industrial complex in and of itself, all owned and operated probably by the exact same experts. They're very, very good at getting you to forget to use your brain and not use any logic at all. So back to Lucy's question about blood donating and getting rid of ferritin or lowering ferritin, which is dumping out iron because you're donating or dumping blood. Well, I would tell you that the non-heme iron that you have in your body that could be bound to ferritin is locked up. It's locked up. You could donate all the blood you want and you're not going to unlock the yucky non-heme iron that we can't use. So what you're doing when you dump blood, you're dumping out heme iron. You know, a period for a woman, actually women are able to get rid of their iron a lot easier because they have a period every month for 40 years, right? And so they're actually somewhat healthier than a male who can't get rid of any of theirs. But why would women have such heavy, painful periods? Could it be that they have iron overload and we just give them some ibuprofen or put a heating pad? No one even thought. What about women who are during their pregnancy and delivery have large amounts of clotting? Is that the body's way of getting rid of iron overload? I think yes. I've been taught that. I've read that. All of these things. So if Lucy decides, hey, I want to lower my ferritin, I'm just going to go dump blood, you're dumping out some good stuff along with some bad stuff. And that's just going to indicate to the body that the bone marrow needs to get active. So the bone marrow starts pumping out a bunch of red blood cells, stem cells, right? And you're going to try to blast more red blood cells out. Could that stress the body, the bone marrow? Could it stress it so much that we could be leading to cancer? I don't know. I'm just trying to think logically. I'm just trying to use my brain. It might be wrong. I like to think up hypotheses a lot. I like to just say what ifs, like what if? And so, no, I'm not a big believer, especially for women who are still having periods. There's absolutely no reason to be dumping blood, okay? I think if you're somebody who's got severe iron overload, I don't know if I could recommend that either because you are stressing the bone marrow. So, Lucy says, no, I'm not dumping blood. Just wanted to hear your take. Thanks, Dr. J. You're very welcome. You're very welcome. Lara says, why bother with the starch at all? Just eat meat, eggs, cheese. Why anything else? I agree, Lara, but you're talking to people who have lust and addictions, and it's difficult. Once they get to where we are at, Lara, then it's different. And it's easy for us to say, and Lara, I know you, and I know it's only coming from a good place, but most of the people, 90% of the population is eating foods that are standard American cuisine. They're full of the things, and then the ones who really want to eat better, they're the ones that are eating the salads and the vegetables, and they're usually women. Ooh, it looks weird for a girl to be eating a steak or eating meat, but it looks appropriate for them to eat some tuna on some salad, or just eat the salad alone and maybe put some beans on it or chickpeas, because that's girly. It's not girly to watch them eating steak and hamburger and chomping into a steak. That's not feminine. You see how we've been brainwashed with this girly thing versus a male thing? I mean, it's a bunch of BS, but we've been brainwashed that it's okay for a girl to eat the cereal and eat it 3 times a day, and eat the legumes and the spinach salads, and oh, she's so healthy. No, she's actually worse. At least the man was chomping on his steak and then eating dessert. Remember, Lara, you're thinking, this is a good one. You know how our parents used to say, if you finish your veggies, you get a dessert. You see the incentives that get us to do stuff? It is amazing. Good morning, Dr. Christy. Thanks for joining in. I just basically got done with my iron, rant, but thanks for joining in. You guys, if you want to know more about iron, either, get a hold of Peter at Glucopharin, or get a hold of Dr. Christy. I know a whole lot about a lot of stuff, but these people, when it comes to learning about, the in-depth ins and outs of iron, I'm just learning this stuff. But those two and a few others, all they do is study iron. And again, it might not translate to all the other stuff, but maybe it does. So if you are, where I started all this, if you're consuming a ton of oxalates and you're consuming a ton of non-heme iron in the exact same things that have the oxalates, like the plants and the grains and the seeds and the nuts and the almond milks and the potatoes. People don't think potatoes or tuber plants. And those are full of heavy metals. They're growing in the ground. Our ground is saturated. You think your potato is free from glyphosate because you bought it organic? Think again. All of your wheat plants, your oat plants, your buckwheat plants, all of them full of oxalates, full of phytates. If you want to soak them and sprout them for 3-4 days, then pressure cook them, by all means, go for it. I say, don't eat it in the first place. Don't get the non-heme iron. Don't get the oxalates and the phytates and the tannins. But again, you have to make a decision for yourself. Okay? Lara says fiber is HELL for us. Another brainwashing ad campaign done to us starting in the 80s. Yeah, I don't think I was brainwashed until the 90s, maybe early 2000s. And boy, was I brainwashed. Do you know, I was eating, I bet, scoops of psyllium fiber. Scoops of it. Every day. Forever Cowgirl, I understand. Forever Cowgirl keeps a list of oxalate. Actually, I snap pictures and they're on my phone. So if somebody really tries to get after me about stuff, I just show them there. Oh, you want to see how many oxalates you're eating? Yeah, but we can tolerate it. Because we become resistant. We become oxalate resistant. You just keep feeding it in, right? It's getting stored. Just like your iron is getting stored in areas where you don't need it, where you can't use it. Same with oxalates and phytates and tannins. They're all getting stored in our joints, in our skin. It's causing aging. A-G-E, age. Your wrinkles, your skin color, the lack of glow, your paleness, the bags under your eyes. All of these things are indicators. Your joint pain, your liver distress. If your liver is not working, or you think it's not, most people think their liver is working just fine because they feel fine. You feel fine feeling sick. You don't know what it feels like to not feel sick. You've become so resistant to knowing what normal is, go off of it. Go on an elimination diet. Just try it. 30 days. Just go meat, salt, and water. Ruminant meat, salt, and water. That's it. Just eat ruminant meat, salt, and water. 30 days. Then I want you to add back. I did it actually. And you know what the plant of my choice was? Peanut butter. I love peanut butter. Love it. Almond butter, any nut butter. Macadamia nut butter, which is, by the way, less bad than all the other ones I just mentioned. Walnut butter. I would eat any butter. Any. And so I gave it up. Cold turkey. I don't know if I ate that much that I was getting oxalate toxicity. I just don't, I don't think I was. I just wasn't consuming enough of it. But I gave it up for 30 days. And I took 1 tablespoon, all down one chute. I go, oh my gosh, is that heavenly? And the next day, I was cramped over in my belly. And I said, why would I do something like that? Oh, it was an experiment. You had to test it on yourself, didn't you? I did a lot of things where I tested on myself. I've even tested a GLP on myself. When they first came out, when they were, not the very first one, I think it was Byetta. I never tried Byetta. Byetta, Byetta. Oh no, I tried Victoza. And you're supposed to start out, Victoza was the very first GLP, besides Byetta. I tried it out on myself, just to see if it would stop me from eating. I just wanted to see, did I need to stop eating? No, but I wanted to see if a person like myself could have a side effect. And the starting dose is 0.6, I believe. Yeah, but 0.6, then 1.2, then 1.8. So I did this Victoza, which was, I can't remember, if it was a semaglutide, I can't remember. It's been so long. I mean, it's like 15 years now, I think. Has it been 15? Well, 10 for sure. I can't remember. Victoza. You guys can look it up. Semaglutide, I believe it is. Then Ozempic came on the board. It was long-acting. And then Wegovy is the exact same thing, long-acting semaglutide. So you're taking in, and then there's Saxenda, of course. Okay, I'm just rambling. But, so I tried this 0.6, this starting dose. Oh my gosh. I was so nauseated. It only lasted about a half an hour. I didn't know whether I wanted to puke or have diarrhea. It was so bad. So then I would back down to 0.4, 0.3, 0.2. One click caused me to have symptoms. So I said, oh my gosh, how are people eating through this? I had one gentleman who was able to do 1.8 twice. So he would leave the needle in him, click it to 1.8, full dose. Okay? Then he would leave it in there and redial it another 1.8. He did not lose an ounce. I don't know how some people can eat through these medications, to be perfectly honest, when I couldn't even get up to a mild starting dose. Lara says, how do we know if our liver is hurting? Usually it gives us signs everywhere else. Our feet, like I did a reel the other day on our feet. So like cracked heels, pain on the bottom of your feet, plantar fasciitis, burning and tingling, like paresthesias we call them. Our feet. What about our nails? What about our eyes? Red bloodshot eyes, bags under our eyes, swelling, edema in your lower extremities, skin changes, brown spots. There's so many things for liver signs. Our liver is showing us signs, but we've chalked it up to aging because that's the propaganda. They told you those things are normal. Oh, you're just going to get liver spots all over you. Oh, your eyes are just going to get cataracts. Well, that's oxalate toxicity. That's glucose toxicity. That's iron toxicity. That's all of these toxicities. This is normal? Why don't we just eat red meat and call it good? And the butter. Just eat everything that comes from the cow. Like the blood and the liver, nose to tail. Somebody asked me about nose to tail. What do you mean by that? Just eat all of it. You mean chomp on the bones? Yeah, maybe you want to chomp on the bones. Get your collagen. So yeah, okay, you want to know more about your labs. Okay, so Lara, I would get liver function. That's usually in a CMP, a complete metabolic profile. I'll check liver function. And the ones I look at are AST and ALT and total bilirubin. I will also get an extra GGT. I'll get a CBC. I can tell a lot by the MCV on a CBC. I know all of these little code doctor words, but that's why people hire me, is to go over their labs, or they hire Dr. Christie, or they hire Dr. Peter to go over their labs. It's important because your doctor is not giving you the information. They don't know the information. They're looking at the reference range and saying, you look good. I'll see you in a year. And the nurse calls. The doctor doesn't call. The nurse calls. Everything looks good. Just wanted to let you know. Oh, thanks, nurse. Whoever. Nurse Sally. Thanks for letting me know everything looks fine. It's all in the reference range. So upwards, you can have liver function, AST, ALT, the upper limit's 3 times normal, and it'll still be in the reference range. So if your ALT and AST are in the 40s, that's 3 times normal. Optimal is 10 to 15. And your doctor's letting it go up to 45, your liver is suffering. It's giving you symptoms. Your immune system's not working. You're not making glutathione. You're the perfect person to get fungal infections, yeast infections, COVID infections, no glutathione, no immune system, no antioxidants. You aren't probably even eating a meat-heavy diet, so now you don't have the amino acids that you need in order to make glutathione. So not only, you don't even have the bare bones, the bricks to make the house, but the foundation of the liver it sucks. All of these things that doctors aren't talking to you about, I don't think it's malice. I really don't. I don't think doctors are nefariously trying to make you ill so they can give you something. I never once thought that. I actually thought I was helping you. I really did. I thought, well, just give them the medication. They're probably, but if you can you start eating low carb? I didn't even think about animal-based only when I was growing up as a doctor. I just thought about low carb. I knew sugar was bad for us. I didn't know anything else about all of these things, the carbs, what they had in them. I didn't know anything about heavy metals. I didn't know about oxalates and phytates and tannins. I didn't know these things. They didn't train us. They didn't want us to know. They just said, give them the medicine. In fact, there was a doctor on Threads this morning. Do you guys know what Threads is? It's like X. Threads is the Instagram version of X. And this doctor, it says, family practice here. All of you people who think that we're getting paid to write prescriptions, think again. I want to if you do know how to do that, let me know so I can do it. And I'm going, buddy, have you ever heard of pay for performance? You can't tell me you're not pay for performance. The only way he could tell me he was not pay for performance is if he owned his own clinic and he was a solo practitioner. Because all of the other clinics, those big giant clinics, they pay their doctors by pay for performance. What that means is the insurance companies have guidelines. If your cholesterol number is over, LDL is over 130, you go on a statin. The doctor that doesn't write a statin either gets docked or they don't get paid at all. So money is like the root of all, yuck. It can be evil depending on what you do with it. And they say, ooh, I want that money. I'm just going to put them on a statin. Who cares? It's safe. I didn't know anything different. I did it. It should be in the water. Everybody should be on it. You get paid. It's an incentive. You get 49% success rate on putting everybody on a statin for an LDL over 130. Your blood pressure, you put them on an ACE inhibitor. And then you put somebody who's diabetic on metformin and you put them on a statin. All of that garnishes incentives. If you score big, you get big incentives. If you don't, you could get docked. Doctors get docked. Imagine that. And this doctor is saying, my paycheck doesn't represent any of that. I call BS. I do. I want to know where he works. Now, if he told me, because I work my own, I don't get paid for performance. The insurance companies want hospital groups. They don't want the single people who are seeing 10 patients a day. They could care less about me. They just want me out of business. They don't want me to be working. They don't care, right? What is a good MCV and MCHC? MCV around 85. I use anything over 90 as macrocytosis. Macrocytosis are large red blood cells. You can see usually people who have large red blood cells, I have iron overload. Many doctors will say, oh, they have B12 or folate deficiency. I can't disagree with that, but iron overload causes the deficiencies of B12 and folate deficiencies. Some people have problems methylating. That is also a concern. You can check yourself for that. But again, I think if we heal our iron, we can heal our body in a number of different ways. Just my thoughts. Lucy, she's asking what kind of meats can she get to eat glutathione? Our body makes it, our liver makes it. It needs the sulfur bonded amino acids like cysteine, which helps to make methionine. So cysteine and methionine are needed for production of glutathione. Dr. Michael here on my page. Gang, on here, please pay attention. Her and the other doctors she just said know their shit. I work with them and they rock. Thank you, Michael. Thank you. Thank you, Dr. Michael. I appreciate that. Hello, Devananda. Thank you for joining. Okay. I know we got into some stuff here. Jerry says, please, this is your opportunity to ask questions. Make them relevant. Put a QQQ in front. If this is great conversation. I love doing this. I love answering questions. I love teaching you. My favorite thing is teaching. And honestly, you guys, if I'm wrong about something, I have been wrong in the past. I have never been completely right. There are so many things changing. What my practice was 15 years ago is not the practice I had for the next 15 years. It's changing. It's not that I'm flip-flopping. People will say that Dr. Saladino is flip-flopping. I can't disagree with that, but he's got perfectly good way to defend himself. He was completely a carnivore doctor. And then he started changing. So now he's saying, you can eat some vegetables and you can eat these fruits. I'm going to disagree with him. The reason he can say that is he lives on an island and he has access to wild fruits and vegetables, plants. We in the United States do not. Ours are fake. The seeds are made in a lab. They're full of sugar in the form of glucose and fructose. They are fake plants. They're made just a little less poisonous so we can tolerate them over longer periods of time as they poison us. So if they give us the iron in our body and then they poison us with the oxalates, phytates, and tannins, we make a nidus that if I just happen to throw some TB out into the air or these viruses, I'm going to make you more susceptible to getting sick. Pathogens, bacteria, virus, fungus, they feed on these things. They feed on iron. It's like nutrition for them. They feed on sugar. It's nutrition for them. Then we get sick and we say that something jumped from you to me because I breathed on you. That's BS. You got infected from something because of your environment in you. It's your environment. It's your terrain. You're feeding the bugs. You're full of locked up iron. You're full of locked up oxalates and phytates and tannins. You got sugar. Do you know how much sugar that we need in our body at any one time? Our body can survive. It needs a certain amount. 1 teaspoon. We have about 5 liters of blood in our body. We only need 1 teaspoon of sugar to survive. Our brain, everywhere in our body, every organ can survive on 5 to 6 grams of sugar a day. Our body makes that. Our liver makes that every single day. Your brain can survive on whatever the liver makes. That's why you don't need to consume it. You eat 1 piece of bread, there goes 25 grams. 5 teaspoons just plopped into your body with 1 slice of bread. And you ate more than 1 slice of bread. And then you had some potato chips. And then you had potato salad and some baked beans. And then you said, oh, I'm going to make it all better by putting a hamburger or a hot dog because there's my meat, as you snarf down a salad on the side. I'm just giving you information, you guys. But you wonder why you're so sick. You wonder why you're gaining weight. You wonder why your fat is going to your belly. You wonder why men have this beer belly. It's normalizing. We now call it a dad bod, where they have breasts, a man with breasts. That's because his testosterone is converting to estrogen from eating the plants. You want a surefire way of making a man a girl? Give him some soy and some plants. Give him some estrogen forming foods. Increase his sugar content so he raises his insulin, so he can't convert testosterone he's aromatizing his testosterone to estrogen. Make him a girl. And we've normalized it. Ooh, he's got a good dad bod. Ooh, he's got a good dad bod. Breasts, sunken in chest, and a pot belly that looks like he's going to deliver in 9 months, 3 months. He's going to deliver like next week. We've normalized that. It's okay. That's fatty liver staring you right in the face. He can't even look down and look at his toes. And we normalize that. That is not normal. It's not normal to age like that. It's not normal to die with diseases. You know, I bring this all up just simply by talking about oxalates. And I know I stir a lot of people and, you know, their experiences, everything. I had the same experience as you guys. It's the exact same thing for me. I had to undo all of this knowledge and information that I was pumped full of. My glass was so full of the experiences, I had blinders on. Until one day I listened to Dr. Anthony Chaffee on YouTube about plants are trying to kill us, and I snapped just like that. And it was about that same time I went off my statin. Boy, was that an eye-opener. Wondering why I couldn't recover after my workouts. Well, you're just getting older. It's got to be that myosin and actin not working very good. And you got myostatin and all of these things. And your mTOR is high and blah, 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 blah. I stop the statin and I get better. And my muscles start growing. I added fat and ribeye and ground beef. And I went from 97 lean to 73. You don't think that was an eye-opening change? I go, what am I doing? Am I going to get fat? Because I told you fat was going to make you fat. And then you're not eating vegetables. You're not going to get your nutrients. I had the glass of experiences just like you guys. I undid it. My wife eats peanut butter every day. She has a hard time popping it. Why? What? Jerry, repeat. I don't get what you're asking. Catherine, I don't have anybody in my videos, especially if I'm not familiar with people. We do that on special occasions where I will add people. I've already scheduled to have people into my video, but thank you for asking. So, all right, you guys, let's review. We opened up this whole 80-minute conversation talking about oxalates. These are chemicals produced by plants. All plants. Some have more than others. Some are considered safer than others. But they accumulate. They accumulate over time. And they cause trouble. And we call it aging. We do. All of the changes that occur in your body, we call it aging. And so, am I a zealot for animal-based only? For me, I am going to stick to an animal-based diet. I can do it. I don't want to put the toxins in my body. I choose not to. You might dabble in it. If you get joint aches and pains and you're getting histamine rashes and your eyeballs are starting to get cataracts and your teeth are full of tartar, that's oxalates, you guys. That's oxalates. And bacteria. And breathing through your mouth, especially at night. That's normal tartar from things that should not be going on in our body. But you guys need to make it, need to do the thing. If I would have known that whenever I ate spinach and that film that came off the spinach leaves and onto my teeth that I had to go brush off or chew gum right away, I was actually crushing the oxalates on my teeth. Once you crush them, you actually activate them. And if I would have known that it was eating through 2 cell layers of my skin in my mouth and my GI getting into my bloodstream, I might have made some changes. But I didn't know. I was told they were good for us. I couldn't even get out of my own paper sack over my head. You guys, this is what's going on every day with your doctor. You're welcome, Lucy. AJ Armin says, with heart failure, you must take statins. Why? Austin says, are you retired? No, I'm not retired. Mr. Anderson says, I stopped statins 4 years ago, heart failure 5 years ago. You need fat and cholesterol for brain health. I agree. My dad was on a statin his entire life, I think. Not really. He was probably on statins for 40 years. I was on statins for almost 29 years. My dad ended up getting heart failure. My dad ended up with Parkinson's disease. My dad ended up with coronary artery disease, despite being on a statin. He changed his entire way of eating from eating meat-based to eating low-fat, basically no carb, no fat. He was no fat. He was no fat, no red meat. Absolutely no red meat. We went from eating hamburgers and roast beef to eating chicken, boiled chicken, and rice and beans. My dad ended up with 5 vessels completely blocked. It didn't kill him, but he ended up with an arrhythmia. And then he ended up with mild congestive heart failure. You don't think that's from the stuff we consume? My dad was an athlete. He was a runner. That was a problem. I would agree. Long distance runner, increasing mTOR, increasing growth all the time, never going into autophagy. Yeah, that's something. I'm not going to disregard that. I'm not going to completely blame it on statins, but oh, Austin, I heard that too. It was actually on Medscape. And Austin comments, I heard fruit can't even be fed to the zoo animals anymore. They're dying. You're taking what they used to eat. They were fruit-eating animals, say. They ate wild fruit. And then we brought them into a zoo, domesticated them, and so they're eat fruit. We're going to give them man-made fruit. They're dying. They're getting fatty liver. They're getting insulin resistance. They're getting diabetes. Animals in the wild do not get diabetes. Animals in a zoo, they get diabetes. They're scavengers too. You throw them a piece of bread, they'll probably eat it. We're poisoning our animals. And people are worried about all the pent up animals and the cows and the stalls and the chickens. And then they go to the zoo and have fun and feed the animals. That's a joke. That's like hypocrisy to me. So yeah, we're killing our animals in the zoo. We're taking them out of the natural wildlife. We're actually birthing them in an abnormal scenario. And then we feed them our crap, our man-made crap. And then we wonder why they're dying? Yeah. Hunter Wells says, so what do we eat? What do we eat for breakfast, lunch, and dinner? Why do you need breakfast, lunch, and dinner? Practice fasting. Why do you eat so much? Why are we eating so much? Animals in the wild will kill something, eat it. They might not eat again. We were fasting by nature. And now propaganda says, ooh, we need to break the fast and then have a snack and then eat lunch and then have a snack. And all of these times we're eating carbs and proteins and whatever. Yep, we're raising mTOR. mTOR and insulin are growth. They're growth factors. You're growing fat. You're growing cancer. You're eating all the time. You never get into autophagy. Why is autophagy good? It's cleanup. It's maid service. You got a dirty hotel room and the maids come in and clean up. That's what autophagy is. Cleaning up your dirty cells with all the toxins and the poisons that you've built up. You never go into autophagy. Your mTOR is constantly elevated. Your stress is high, which elevates mTOR. Your sugar levels are high. Even proteins will elevate mTOR. mTOR is great. I want big muscles just like everybody else. Well, maybe some of you don't, but I do. If you have constant growing and never get autophagy, you're growing other things besides your muscle, namely cancers, namely fat cells. You're getting insulin resistant. Eating breakfast, lunch, and supper, that was the propaganda. That's the leave it to beaver years. Be home for breakfast, be home for lunch, be home for supper. Let's all eat at the same time. Propaganda. Propaganda. As we feed our faces with fake foods. And then they tell us that a heart-healthy diet of Cheerios is what we need. And have some fiber. And then put some pasteurized crappy milk on it. And then drink fat-free milk. Don't even get the real fat. So what do you eat for lunch, breakfast, lunch, and supper? You eat a meal of animal-based diet until you're comfortably full and don't eat again. Dr. Michael says, Hunter Wells, the answer is meat, eggs, raw milk, no plants ever. Am I drunk? Oh boy. These are the people that need to be off of here. But thanks. Why don't you guys ban some of these people? Yeah, I know he's a troll account. Thank you for telling me, Dr. Michael. I appreciate you being here and managing this. All right. What other questions? What is the cause of floaters? Oh, I get this question a lot. You know, I think because there's unnatural alternative websites or things like that, they will tell you that it's parasites. Do we know? I'm not sure. So I'm going to be honest, Lisa, I don't know the answer to your question. What is floaters? Do we have parasites in us? I go back and forth. If we had parasites in us, I would think that we would be so skinny. Our body is fighting these things off. I think that it's possible that you could have parasites because we have so much iron in our body. So bacteria and virus and parasites and fungus, they consume iron as their source of food. They grow. Okay, that's why we have outbreaks of things. That's why we could have parasites in us. Could it be your floater? Yes. Could it be glycation from sugar? Could it be iron overload? Could it be oxalates? Yes, all of the above. So my thought process, how do you fix it? Elimination diet. Maybe take glucoferrin to help relieve your body of the iron stores and the other heavy metals. Don't take in oxalates. Slowly do an oxalate dump. Slowly do these things to try to clean your body of the toxins. Rachel says, I have so many friends who are vegans and vegetarians. I notice many have muscle loss and are fat. They refuse to eat meat or dairy products due to their ethics. Well, their ethics, they would rather monocrop a field and kill more than what a cow takes up, a pig takes up, a chicken takes up, a turkey takes up. They're killing our microenvironment. They're killing the rabbits and the squirrels and the deer and all of the microorganisms, all of the worms and the beetles and the bugs. They don't have any problems with their ethics when they're killing that microenvironment, but they have a problem not eating a one cow or a one pig who actually help regenerate our land. Yet they've never been to a farm. They've never rode, which I have, I'm speaking from experience, a tractor that is chopping stalks or tilling. Our soil used to have a topsoil of a foot or more, and now it's like an eighth of an inch. We are destroying our land. But that person who's the vegan or the vegetarian has never been to a farm. They wouldn't even know what it is because they probably live in the city full of smog. And you know what? At some point, you got to stop, Rachel. You got to stop trying to push your ideas onto them. That's why I always say, if you want it, do it. I'm not going to push I'm doing the ideas for me. This is me. I'm giving you information why I don't do those things. If I learn differently in the future, I'll let you know. You'll call me a flip-flopper. It's okay. It's fine. But right now, this is where I stand. You can either do what I do or not do what I do. But if you want to know why I don't eat plants, I'm going to tell you. If you want to know why I don't want to have my Iowa farmlands monocropped anymore, I'm going to tell you. I used to love Iowa because of those beautiful cornfields and the soybean fields. I loved it. I adored it. I grew up here. It was my heritage. And now I look at them as destroying our earth. And now when I see a buffalo farm or a cow and they're eating grass up on the hill, it makes my heart go pitter patter and I get goosebumps. And I want to thank that farmer or that rancher for doing what is right. And when I look at it, I love grass. I want to tell you, I love a beautiful yard. And when I look at the rolling hills of the grassland where those animals are roaming, it is so pretty. It's so pretty. So when some of my listeners and clients, they live in the Northwest and they'll send me pictures. And it's just like I go to a whole new land, a whole new world, living through their pictures. And they're my rancher friends. They're my friends now. Let's see if I'm going to get any questions over here on YouTube. Rachel says, can blood cells tests show iron levels? Yeah, you can get iron levels. I thought we understood that. You'd want to get a serum iron level. Okay? A serum iron, a transferrin, a ferritin. Oh, thank you, Rachel. Same to you. Lisa says, it's new for me at 75. What is new to you? Oh, Lisa says, where did you go to school? For the most part, I grew up in Iowa. I went to a small Division III school for undergrad, and then I went to medical school in Des Moines, Iowa. It's a osteopathic medical school. Same training as the MDs. I chose to stay here because it was closer to my dad. I did apply to MD schools. I applied to Creighton. I applied to Iowa City, the University of Iowa. And I ended up choosing Des Moines because it was closer to home. It was an osteopathic school, which really didn't matter to me. But I ended up taking MD boards because I wanted to stay in Iowa. So I wanted to stay in Des Moines. It was just a choice of mine. So they didn't have residencies in Iowa for osteopaths. You had to go out of state. And I didn't want to go out of state because I didn't want to leave home. That is where I ended up. So Des Moines, Iowa for medical school and undergrad in northeast Iowa or eastern Iowa. Habiba, what do you think of ivermectin for parasites? Well, it is an antiparasitic, but I think we're using it for all the wrong reasons. I think if somebody comes down with parasites, we need to maybe take ivermectin. But just simply taking ivermectin on a regular basis or even cycles of ivermectin, I think it's only causing toxicity. I don't think we should take anything. I really don't think we should take any supplements, no antibiotics, no antifungals. We don't need them. We should be eating diets that are full of, nutrient dense foods, and we're not. We're, how are you getting your parasites? Oh, Lisa, my mom watches Yellowstone, so I have seen it, and yes, I do love it. You're absolutely right. I love watching Yellowstone. Yeah, my mom watches that all the time. Okay. Well, are there any other questions? I'm not seeing any other questions. We can call it quits. As a review, we started out this conversation with oxalates. I talked about vitamin C. I talked about how much where our body can process. Our body makes normally about 12 milligrams. We can process about 26. Some people go upwards to 200 milligrams. But after that, it usually becomes toxic, especially if somebody who has low kidney function. All right. We talked about the different plants. There is certain plants that have more or less oxalates. We can also process them different. You can sprout them, ferment them, boil them, pressure cook them. You can soak them. Again, those are your choices to lower oxalate content. In my eyes, I don't consume them. I'm not going to go through all of these, soaking for 3 or 4 days, then pressure cook my stuff, sprout them, buy them sprouted. I don't trust anybody sprouting my stuff, fermenting my stuff. I'm just not going to eat it. It has no nutritional value. None. Okay? Plants decrease the absorption of the things I really want, and those are amino acids and free fatty acids. Those are the things I want. We are not squirrels. We do not eat nuts. I do not eat grains. I'm not a cow, nor do I want to look like a cow. I don't drink teas anymore. I gave it up. Teas, and especially the leaves, depending on how long they live, that has more oxalates in it. So your black teas, your green teas, they have high amounts of oxalates. Herbal teas hardly have any oxalates. Do I drink herbal teas? No. If I had cancer, I'd be drinking herbal teas. If I was fasting for 14 days, I would drink herbal teas. Which ones? Probably dandelion, maybe burdock, maybe sarsaparilla, something like that. But no, I'm not going to drink teas. What else? We talked about oxalates and vitamin C. We talked about Parkinson's, dementia, buildup. We've talked about iron overload. We talked about a lot this morning. So with that being said, if you guys would like to consult with me, go over your labs. What if you're a person who wants all these labs, your doctor won't order them, I can order them. There are 7 states I cannot order labs in. I believe Rhode Island is one of them. I would have to check. But if you want me to go over your labs, if you want me to order your labs, your doctor won't order them, just get a hold of me. Either message me through Facebook or Instagram, or email me, IronLadyDoc@AOL.com, IronLadyDoc @AOL.com, IronLadyDoc@AOL. We can schedule a consultation. You can, even if you want your labs ordered and you don't want to hire me to go over them, that's fine too. I'll order your labs. No one else will. If you want to be able to read them yourself, all the power to you. If you want some help reading those, I'll be here for you. But so I can order your labs. We can sign up for consultations. We can go over your labs. You know what things are free? You know what things are free that you can help me? The like button, click it. The subscribe button, click it. The follow button, click it. The share button, share it. All those things cost you no money. Okay, so if things I said today you feel like could help somebody else, please share them, okay? All right, so we'll call it quits. I will be back every Saturday, Lord willing, at 9 a.m. Central, every Sunday at 10 a.m. Central. During the week, I do reels with some sort of topic. I also have a membership. It's $100 a year where you have an ability to ask me questions via text or email. I also send out a newsletter once, twice, 3 times a month. Okay, so if that interests you, get a hold of me. It's $100. I've never had anybody that has signed up for the $100 and has abused me with overall text messages. If it's getting a little out of bounds, I'm going to say, hey, we need to back off. If you need to do a consult because you're asking me way too many questions. They're getting too difficult to just be on a text messaging platform. Okay, so then you spend the money and you hire me for a consult. It's $110 an hour. Okay. Hi, Iron Lady. Loving the content. Please, can you shoot me out? My name is Isaac Hunt from Manchester, UK. You guys, say hi to Isaac from Manchester, UK. Alonzo says, you are so knowledgeable and real. Keep on the good work. And have all the bad people saying bad things go somewhere else, please. Alonzo, you're going to have that, okay? There is going to be people who don't like what you have to say. If I have something that people don't like, if I read something or you say something that I don't like or I don't believe, I kind of keep it to myself. I don't go asking for trouble. It's not worth it. It really isn't. They have their own. I was bamboozled at one time. I really was. And I opened up my brain. It started working. And I've relearned things. And that has made me very happy. The bad people, they'll go away. If you don't acknowledge them, they'll just go away. They'll fall off. They'll start trolling somebody else. And, it's not how I was brought up. It's not my beliefs. And that's it. So you guys, yeah. We'll see you next week, next weekend. All right? So you guys have a great rest of your Sunday. See ya.